Hello doctors, my name is Faraz from Prathama Medical College. Today's topic is gout. Gout is due to monosodium uric acid crystal deposition in joints or soft tissues, due to which there is hyperuricemia. Let's come to pathogenesis. These uric acid crystals phagocytosed by macrophages and neutrophils, which triggers inflammatory response, due to which there is a recurrent attacks of acute arthritis seen. In simple, in exam you can write like this: adenosine and guanine, which are purine nucleotides, broken down into hypoxanthine, and this hypoxanthine is converted into uric acid via xanthine oxidase. If you want to impress the examiner more, I can explain you more detail about how these uric acid crystals are formed. Let's come. This is lumen of small intestine. Lumen of small intestine. Okay. This is enterocyte. Enterocyte. Normally, DNA and RNA are broken down into purine and pyrimidines. But we are talking about gout, so let's check purine. This purine is broken down into AMP and GMP, which are nothing but adenosine monophosphate, guanine monophosphate. This AMP is converted into hypoxanthine. GMP is converted into guanine. So these both are broken down into xanthine. Okay, xanthine ultimately broken down into uric acid. We know that with help of enzyme called xanthine oxidase. Then this uric acid formed here in enterocyte enters into blood, enters into blood and filtered by kidneys and removed from body. Okay, normally in gout it is due to hyperuricemia, and these uric acid levels are increased in body via two mechanisms. First thing, this uric acid levels enters into blood, right? There are too much of uric acid levels. Okay, there are too much of uric acid levels, due to which there is a hyperuricemia in blood. And one more thing, when there is a problem in filtration, this uric acid crystals can't be excreted from the body. So because of these two reasons there is hyperuricemia. So let's come to clinical features part. Patient presents with severe joint pain, redness, swelling, warmth is seen, hyperuricemia is seen, most commonly seen at base of great toe, that is podagra. This is how podagra looks like, and it is most commonly also seen at metatarsophalangeal joints, also seen in knee. So these are clinical features. Let's come to interesting part. Types of gout. There are two types of gout: primary gout, secondary gout. Let's come to primary gout. It is not due to any disease or medications. It is due to, like, there is no any cause. Okay, it is an unknown cause of hyperuricemia, but in most cases it is associated with under excretion of uric acid via kidneys or urine. Let's come to secondary gout. Secondary gout is due to other diseases or medications. There are many causes. Example, seen in patients with leukemia, myeloproliferative diseases, Leishman syndrome. We know that it is due to deficiency of enzyme called HGPRT. You have read in biochemistry. Okay, patients with renal insufficiency also seen with secondary gout. One more thing, this is all about primary gout and secondary gout. Patients also present with acute gout and chronic gout. Let's come to acute gout. It is a acute inflammation with painful arthritis of grade 2 or podagra. We have learned before. Triggers of gout. It is due to alcohol intake, more meat. Let's come to chronic gout. It is due to long-standing high levels of uric acid crystals for long time. Okay, patient present with classic feature in chronic gout. There is a classic feature that is TOFI. Okay, TOFI presentation, which is nothing but white chalky uric acid crystals in soft tissues or joints, due to which leads to renal failure. Why renal failure? Which leads to renal failure. Why renal failure? It is due to uric acid deposition in renal tubules. This is how a histological slide of TOFI looks like. This is white chalky appearance. You can see here the uric acid crystal deposition in soft tissues. This is how TOFI patient with TOFI looks like this, okay. Let's come to lab findings. Hyperuricemia is seen with needle shaped crystals with negative bifringence under polarized light. Arthrosynthesis is done. Needle is inserted into synovial fluid. Sampling of synovial fluid is done. There are increased WBC count, that is from 20,000 to 50,000. Let's come to treatment part. Normally treatment part is not needed for pathology, but let's learn. For acute gout attacks, NSAIDs are given, glucocorticoids, colchicine is given. Preventive part, xanthine oxidase inhibitors are given, that is allopurinol, febuxostat, pegloticase, probenecid is given.